All right, the time being 6 o'clock, I would call the Board of Health meeting to order. All members are present with the exception of Jason Harris. Would everyone please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. Our first item on the agenda this evening are public announcements, specifically announcements from the Health Department. I will turn things over to the illustrious Lindsay Wright.
Hello. Thank you for having me today. So a couple things we got going on. As everyone knows, we had a boil water order over the weekend. So something that the town has had in place for about 3 years now is the Code Red emergency notification system. It is an opt-in system. So we have been talking about this for about 3 years now. You can go on to www.abingtonma.gov, scroll all the way to the bottom and click on the Code Red logo, sign in as a guest and create your account on Facebook now, and on tomorrow on the town site there will be instructions on exactly how to do that. Somewhere on the town's YouTube page on the town's YouTube page there is a video instructions on how to do it from when we first launched this, but that is the best way to receive the real-time notifications. As soon as the boil water order came in, that's the first place I went to send them out. Then it gets rolled out to social media. Then it gets rolled out to the town website. It's a process. It's a lot of moving parts. But this is the first place because it can go out in mass. Code Red, I think, calls, emails, and texts something like 1,000 people every 30 seconds. So as long as people are opted in, they get the information. Bit of information, just so no one panics. Next week, there will likely be a bunch of official vehicles, state police. You'll see fire officials, not state police, but municipal police. There is a training at the library. We are hosting the Basic Academy from Emergency Management Institute. So we'll have different municipal officials in town taking the Science of Disaster class, just for residents so they're not panicking about what's going on. We're just hosting a class. The town website, the town Facebook, social media pages, we are the only source of information that is accurate. Again, going back to the boil water order, there was a lot of misinformation spread, a lot of confusion. The order was written by DEP. It was then transcribed to Code Red and sent out. I know there was some confusion about, who it affected. It was Abington and Rockland, because that's who the Abington-Rockland Joint Waterworks serves, with joint waterworks customers in the remaining communities. I don't want to misspeak
Whitman,
now.
Hingham,
There was two H towns,
Hanover or something.
Pembroke and
Hanson,
Whitman.
Hingham.
But anyway, it was
Fringe.
those joint customers in those towns. So there was a lot of confusion. Who did it affect? Who did it not? And so just, if there's any confusion, as much as we lean on social media to spread the official source, it can also be a very rapid fire way of spreading misinformation. So please go to the town social media, the health department. That's where you're going to get the actual real information. Our office, or actually town hall in general, is closed Monday the 27th in observance of Memorial Day. Letters have gone out for second trash cart fees. So if anyone has a second trash cart fee, that $75 fee is due. You can pay it by check in our office, send it back in the mail or online. We are looking for compost site volunteers, 9 to 2 on Saturdays. Sharps containers, we had posted, I think now going on almost 2 years ago, that we had a pretty hefty stock of Sharps containers that we were going to be able to give away for free. We have officially depleted our stock. So we will be ordering additional. Our supplier was actually out of stock. Once those come in, we will be going back to our $8 fee for sharps containers. And then when they get returned, they are free to return. We can only take household generated sharps. We can't take residential program generated sharps. It's just the household. And then the compost site will be open this weekend, even though it is Memorial Day weekend. So please thank our volunteers if you're dropping off. CPR, we should be all set to go. I personally have a little bit of a hectic week this week and next week, just with a couple, we're in like this weird quarterly transition. So it's just the monthly and quarterly meetings. Check with me June 16th and we can get stuff scheduled.
I appreciate that.
Household hazardous waste days, it's ssrcoop.info. The next two are June 7th and June 21st. You can register online. Once you're registered, they'll give you the details of where they are. We are seeing increased tick activity. The nurse and me, please don't pull them off. You can leave their heads embedded and that can cause more of an issue. Either give us a call at the health department, we can walk you through it, or just YouTube how to remove a tick, but please don't pull them. And lastly, mosquito season is upon us. So start repairing those screens, making sure we're wearing bug spray, long sleeves if we're out at dawn and dusk. And then Plymouth County Mosquito Control, I'm so sorry, is responsible for the spraying. Requests to spray and then to not spray in your area are made through their website. It's www.plymouthmosquito.org. They notify us when they're spraying. They update their site weekly. We will do our best to update our information. The site will get posted on our all of our stuff, but we will do our best to update our stuff, but just check their website for their spraying schedule. If you have standing water, they're willing to come out and check to see if you have mosquito larvae. They will begin accepting spray requests on May 27th, and then the tire recycling has ended for the season, and that will start again in the fall. That is my update.
I have a question.
Yeah.
Lindsay, did we have any confirmed cases reported of E. coli?
So it takes a while. So even if someone had gone to the hospital and they tested for it, it will
Wouldn't
take.
get back to you right away.
It doesn't. It's usually about 2 weeks delayed, a week and a half to 2 weeks delayed until we see it. I can't speak to any local facility, but I will tell you, when I was working in the ER bedside, if we knew that there was a boil water order and someone came in with active symptoms, physicians typically didn't send out samples. They just empirically treated.
Yeah. And then it wouldn't get reported back to you
And
anyways.
it wouldn't get reported.
Yeah. Yep.
Because
Yeah.
it,
Manpower.
it becomes just if it walks like a duck and talks like a duck. That was,
You're going to treat it like a duck.
it was all of our physicians' kind of mentality. And I can't speak to clinics down here. That's just where I worked. But typically if people presented and said, I'm coming from somewhere that had a water issue and I'm symptomatic,
You would treat for it.
we would just treat it.
All right. Any other questions?
But I will, if something pops up, I will follow back up and let you guys know.
Cool.
All right. Lindsay, thank you for the probably lengthiest and most detailed
Well, you know,
update we've had in a while. So thank you for that.
I think since the last time I was here.
All right. We'll get into our discussion and action items. I actually think most of these things are fairly quick and easy at the moment, but I'm sure there's more to that than meets the eye. So with that, we'll use our collective brain, Lindsay and I, to talk about the first item, which is a discussion and vote to authorize the Massachusetts Health Officers Association, which is actually MHOA, which I abbreviated wrong, agent status to complete underage tobacco sales compliance checks. Do you want to say anything before I say anything?
So to my knowledge, if I misspeak, I apologize. This is something that MHOA provides to the town. to do these compliance checks. In order to do this, we have to, or not we, but the board has to vote them. I'm going to mess up the language and I apologize.
I have the exact MOU, so if you want the
Thank you.
verbiage.
But we have to, the board has to vote so that they can assist us with these compliance checks. Unfortunately, it is something that not just us, but other local communities are seeing, that underage individuals are able to obtain tobacco products. We're seeing it a lot with vape products. And so to be able to use this service from MHOA would be hugely helpful, because, you know, I can go into a store, Chris can go into a store, they know us.
Yeah.
But if someone who their job is to go and do these compliance checks across the state, they've been found to be really helpful.
So the verbiage is actually, it just says that we're going to authorize the MHOA to provide the services described above, which are they're going to recruit and train an inspector and underage buyers for this. They'll be an employee of the MHOA. It's not really our purview, but preside with the results of daily compliance checks following, for the business day. And they're solely responsible for the safety and conduct of the buyers. So the bottom line is that we need to authorize them to provide this service because they'll be acting as an agent of the town, and technically we've only got one health agent. So we need to authorize this person to do that, this MHOA to hire somebody and do that. That's really all that is. So we should have a discussion about it if there are questions. I see your phone's ready, so.
Oh, no, I didn't.
Oh, okay.
I
was like,
had,
I'm ready.
I had a bunch of questions when Chris initially sent that out via email, and I had written to him with just a couple of things, which I can share with you guys, because I know he had a hard time forwarding it back as a reply to all, so it was only able to come through to me. So I had wanted to know, does the MHOA request payment for this service? And he said, no, it's free and saves us the cost of hiring and training someone to do this. I wanted to know what his thoughts were about if there is suspected businesses selling to underage clientele. And he said that he has a pretty good relationship with most of our tobacco retailers, but several have been caught selling untaxed cigarettes, and tons of kids at Abington High School, Middle School, exactly what you had just said, Lindsay, are smoking vapes, so probably worth checking. And then I kind of wanted to ask about what happens to the businesses that get caught. Are they automatically losing their licenses? And he said no, but a $1,000 fine per state law, and Board of Health can elect to suspend their permit for a period of time as well. And that was it for those ones. The other ones were all related to the secondary topic that we're going to discuss. So that all, I think, was helpful information to have. I like that our community isn't going to have to brunt the bill of this. I like the idea of making sure that people who are employed to these businesses are doing what they're supposed to be doing based on the rules that we just went over recently for tobacco. That's my thoughts. So I'm in favor.
Yeah. I mean, again, this is purely procedural. It looks like in my mind, we always utilize partners to make sure that we keep the community safe.
I've seen this before. We've had these fines before. I'd be curious who gets the money. Does it go to the town, or does it go to the tobacco company that's hiring these people? But that's just a curiosity. That's not in opposition to it. I'm for it.
Well, if they're getting fined, they're getting fined through our regulations. So, however,
it would go to the general fund?
Well, it would go into however we absorb fines in the budget.
I think it's...
Believe they go to the general fund.
Yeah, exactly. So, and I think we mirrored, unless it's a state violation, which is probably its own separate thing, but we mirrored the state fine structure anyways. So it doesn't matter. It's still going to be.
I just always like to know who
Yeah.
gets the money.
Of course. And then it was. No, I'm blanking. Okay, well, anything else?
Do we vote on this today?
Yeah, we can, because then there's still paperwork that needs to happen. We're just saying we would allow this to happen, and then that allows the health department to execute the rest of the paperwork.
Do you need a motion?
I would entertain a motion.
I'll make a motion to approve this.
Motion to approve by Susan. Is there a second?
I'll second.
Second. Any further discussion? All in favor?
Aye.
Aye.
Opposed? It is unanimous. So,
So we're gonna
Go ahead.
Thank you.
Wonderful.
4-1-0.
yes. All right, we'll move on to our next item, which is just a discussion regarding the long-term storage of sludge and septage per 310 CMR, section 3231. So I have a copy of that, but I'll kind of give the background, unless you want to talk about some stuff with that, because you were from the health department.
This was wild.
So this was the craziest concept that I think I've ever had proposed. Just the initial like business concept.
Yeah.
So they came to us and explained how this whole, do you have the business model in front of you? I don't want to misspeak. It's so incredible.
I don't, I just have
But
some
so-
procedural
It says
things.
Yeah, I didn't get
long-term
anything.
storage of sludge or septic. So item 2.
Oh, I wasn't even going right
Oh,
then.
no.
Yeah, what
Okay.
exactly they wanted to
So
do with
the,
it. Yeah.
we were presented with taking a porta potty and separating the urine from the solid material, and then further separating out what could then be turned into fertilizer from the urine. And I just remember sitting in my office going, huh? Like, that's a thing? And it is a wildly successful model. They are up on 18? Wait, yeah,
Yes.
Wasted is up on 18 across, I want to say, it's right across from
Yeah, I think,
Sorrel. But so they approached us about doing this on a larger scale, which meant that they would have to store
Septage is the way they put it.
septage on site. And so there was no concern from the DEP side of things. It's already separated, actually in the facility itself, or in the
It
porta
says
potty
it's
itself.
Only collected in the urinal.
Yep.
So that means it's only male urine. Interestingly.
I mean, if you want.
I
Yes,
don't know if I
in
want to get
theory,
into the
yes.
minutia.
It's very weird.
Oh, okay. So when this was
Random
the
thought.
this was the most interesting phone call I think I've ever received, other than burying a dead horse. So on the Board of Health, that is. So when Chris brought this up to me, I had asked that we make the request to Wasted PVC to come in and make a presentation to us with exactly what they want to do. Mainly because we're all trying to wrap our head around what the heck is going on here. I believe the regulation does say that storage shall not occur at a site without prior express written approval of the Board of Health of the city or town in which the site is located. That's why we're involved. And I believe if you look at it, there is a time period in which, no person shall store sludge or septage for more than 42 days within a 6-month period, except in compliance with the previous regulation, which is explaining how to do it. Which one of those things is without detriment to public health? That's a very broad statement that allows us a lot of ability to enforce. And then the additional requirement, which is we're not going to allow them to do it without our approval. So they're going to have to come before us. I didn't want us to vote on this until they actually came to us and made this
Yeah, I
request,
think that's a good
especially
idea.
in writing.
Yes.
So it can go in the file, things like that. We haven't heard back yet. But that's what that is. When this comes up, when somebody says, why are we looking at septage and sludge? This is the request, and we just didn't want that to be a surprise.
But I will tell you, if you in your spare time, look up their whole business model and what it does for fertilizer, it's actually incredible. Talking about strange phone calls, when Chris told me he had urine on his desk and I walked in and it was powder. But it's,
Interesting.
yep.
Well,
it-
now we know the name of the business, so we can do that.
Yes.
Yeah, because this was it, yeah.
And I know that people are. I know, I'm just going to pivot because I don't want to think about this anymore.
Sorry.
I know that people are probably skeptical as well after this past weekend with a boil water order. But I will put you at ease to know that there are regulations specific to that on how to protect the groundwater and public water supply.
There is a stream right there.
If you look at
So there are very specific requirements.
310 CMR 3231 talks about our authority. If you go back one to 3230, it talks about protecting the groundwater, protecting the water supply. So anybody at home has questions about that, go read that portion of it and understand that those are the things they're going to have to comply with at the state level. And then the secondary thing is having our approval. So just want to throw that out there. Okay. Any other discussion on this? Enough potty talk for the evening. All right. The next item would be to approve the minutes, but we had a little hiccup in getting them to everybody, so we'll just push that off and approve it at our next meeting. Also, we'll have more board members, so it'll make a little more sense. Health agent report is attached. Lindsay, do you want to walk us through that?
Yep. So there are listed on the health agent report are the inspections that Chris has gone out on. You'll see one of them was a re-inspect for one of the pools in town. That was a phone issue. It was not so pools are required to have landlines. Did not have a landline that was connecting. It was just a technology issue. So that's been fixed. Let's see, the priority violations were at the, I'm actually not sure which food establishments, I apologize. DOR did their tobacco inspections. Let's see, I apologize. Need my glasses. Came in, there was one suspension that happened as a result. And then the health department has been involved with the ongoing complaints of
The mice.
rodents at several different properties in town. And so, constantly doing some education with management companies and going over different mitigation strategies with tenants and also management company. Chris and I attended the Preparedness Summit in San Antonio that was paid for us to attend by the HMCC and Region 5C. We got some incredible information to bring back. Had I not been with the boil water order, I would have probably thought to prepare more about what we learned there next time. And then Chris is in Bloomington, Illinois, or well, trying to get to Bloomington, stuck in some traffic at a private well conference this week.
So tobacco license suspension seems pretty fitting.
Yes.
Was that related to?
That I don't know.
Okay. All right.
I'm not sure.
I'd be curious to know.
So typically, it's either untaxed or underage.
Yeah.
Has been,
Well, again, I know that's DOR is typically, that's their thing, so.
yep.
Doesn't the office usually get like a letter after it happens as to why?
Yep.
Yeah, you might not have gotten that letter for this yet. And of course, everything that you've done, thank you from the town for this past weekend. But, so that might explain
Yeah,
that.
exactly. Well, and like Chris is away, he might know and whatever.
Yeah, that's possible too.
Yeah, if it's, well, again, it's one of those things, it's, a lot of those letters will come in the mail, so it's,
Yeah.
I think, yeah, if
But-
I remember, it used to be afterwards, because
Right.
it has to be afterwards.
Right. Well, and with it being a DOR thing, I mean, it's just, I find it funny that if we are being asked to do compliance checks and this just happened, then reinforces the need. So just, that's the point I was trying to make more or less, but. All right. Public comment. Anybody from the public have any comments? No? Yes?
Hi, I'm
Hi.
Joe Frame. I was a little bit concerned on the way that the boiled water situation was handled. I wouldn't have known anything unless I called Susie and saw her on Facebook and said, what the hell's going on? I have a husband that's very sick. And I thought I was signed up to get a I am, because if somebody's lost or school's closed, I don't even have kids, and I get a call. Nothing. I tried to call the town hall, nobody answered the phone. now I'm hysterical because I had washed my dishes the night before in my dishwasher, so I took them all out, boiled water, and went out and bought water. Didn't even use the town water. I spent over $100 for water because I refused to even boil that water. I was using spring water. And then I was rinsing in spring water. And there's gotta be some type of a system, a hell of a lot better than what we had. Because it was not well. You're reading things on Facebook, and even with Jeff Moore, this person was saying that. I never got a call telling me that you no longer had to boil. I was going to Rockland Town Hall, their town hall had a big huge sign, no more boiling. I just, you know, when you have a sick person, maybe there should be a special list if you're on kidney failure, that, you know, you're notified right off the bat, or something that,
So-
I'll tell you, I was a wreck.
So,
I was in
Mrs.
tears.
Mrs. Franny, so I apologize that that was your situation. I'm truly sorry that that's how your weekend went. I can tell you personally that I am the voice behind our Code Red notifications.
Yeah,
I-
I saw that before.
So we have been sending them out for about 3 years. So I got the notification, and within an hour, the first one went out. And then yesterday, when it was lifted, that went out. The only reason why that one was delayed was because Code Red was having an issue, and that was resolved within maybe 15 minutes.
Well, I tried, I think it was Ellen,
Um,
that shared the link. Somebody had shared the link on Facebook, Cold Red,
sign up,
sign
yes.
up, and I couldn't get it.
So the way that the notifications get made, and it is, the Code Red is an opt-in platform. We legally can't blast everyone's phone in town with every notification with this system. There are certain things, the state, Amber Alerts, things like that, that the state is able to do that. But on a town level, we have access to this community notification. I'll give you this, or you can come downstairs with me and we'll get you enrolled. But as soon as that notification needed to go out, it went out. It went on to the town website. The health department voicemail was changed. In fact, you saying that reminded me I have to go change it because it still says boil your water. So please, you don't have to boil your water. Don't listen to the health department voicemail right now. And so I know there was a lot of different experiences with this and a lot of frustration that happened. Something I can assure you, because I have been involved with the Code Red since the town adopted it about 3 years ago, is that this is something that we have been doing. And I'm not just saying that because I work for the town, it's because I'm the one that records all the messages. I'm the one that sends them all out. You know, I was down in sunny Florida and you guys were getting a blizzard and I was standing recording a message while Test Track was whipping by me at Epcot. I think Epcot, yeah. And I had to record the message several times a couple years ago because you could hear the whoosh of the cars coming by. And so this is something that, you know, the town believes in. It does work, but it's something that we have to opt into.
Because some people, my neighbor, not my neighbor, my girlfriend who lives down in the Woodlands Apartments down there, she called and she told me, I said, yeah, I saw that on the Rockland Town board. And she said, well, didn't you get a call? And I said, no. She goes, I got one. I said, well, I didn't get one. And today I saw 3 or 4 people on Facebook saying, well, I got 3 calls and this and that, and I never got one. Well, what we used to have, I think years ago, was it Next?
Yeah, Nexel, that's what he had, and then, yeah, and I don't know why we don't have Nexel anymore either, because that's a lot of hesitation, myself included. I don't want to sign up for Code Red, because then next year it's going to be something else.
So-
And I'm stuck on Code Red.
So Nixle didn't allow you, don't quote me, there was an issue with Nixle that we couldn't, so with Code Red, we can, I believe it was the geofencing of it. So with Code Red, we can actually target specific streets, specific neighborhoods. So let's say that, relevant topic, trash or recycling is poor Dave or Mike, their truck isn't functioning or something happens and one street is affected. I can go into Code Red and click on or highlight that neighborhood. And anyone signed up in that neighborhood will get the alert. And I won't drown everyone in town with
Mass
alerts.
panic. Yeah.
Correct. And so that's something that you're able to do is geofence with this.
I will say too, I even get notifications. National Weather Service says there's a flood warning or something, which I assume doesn't even come from you guys. It's
Nope,
just
National Weather Service alerts are automatic.
Those just come,
Yep.
so.
Once you're signed up
Yeah.
with Code Red, we have no control over National Weather Service alerts.
May I make a suggestion, maybe? Because it does, I agree with Mrs. Franny. There's a lot of people that either don't know about the Code Red or anything. Perhaps we could just start with one group, and maybe do something down at the senior center, which I think might answer a lot of the same people.
I did.
Did you? Oh,
Yep.
that's too bad, because then I
Yep,
guess
so-
it didn't work. Yeah, I was just trying to think of ways to solve the problems, because I like to solve the problems.
Yeah,
We're
no,
always gonna
I'm-
have problems, we gotta solve
The
them.
next thing is how, like some of these seniors who don't have, how would they know?
Yeah,
So
I
it,
know when the kids are walking down the street from school, and saying, don't drink the water. And they said, we know Mrs. Vernon. And I said, okay. Now, my neighbor across the street who's brand new, who just had a baby, she was going out to a doctor's appointment. I says, don't use a baby, well, she breastfeeds. Well, I didn't know, I'm old. And so I said, you don't, and she has, we're 2 years, I said, don't drink the water. She said, why? And then I told her. So she said, oh my God, so. And then she called her husband at work and the whole thing, so she was going to buy it. There was no 5-gallon water in Stop and Shop. It was totally out. It was unbelievable.
So-
the water.
the nice thing about Code Red is it allows you to put in a landline phone number, and the messages that are recorded then will go to a landline. And so that everyone, and so this allows for hearing impaired, it offers translation, so if someone opts in and one of the, I think it's 60 languages, and so this is an accessibility, it's a accessibility and equity thing with Code Red. I think that was one of the issues with Nixle is it wasn't, we couldn't get landlines, it couldn't be translated. There was a accessibility, I want to say that might have been it. It was a
well, it
lo-
was 3 years ago.
it was a long time
I
ago.
cannot expect you to remember it.
And so, unfortunately, there is no one real quick answer.
No, I know it was hard too, I know, but, you know, I always.
But I am sorry that that's the experience you had. You know, if there is something that any resident, if you yourself have a different way that someone can come up with, I'm happy to, I would love to hear
No, I'll just get into Code Red.
the ideas.
Code Red.
But as soon as the Code Red went out, we got, poor Sean Riley heard from me. I didn't realize he was away. So he got interrupted on his vacation so that we could change the signs. So all the signs were deployed across town, our mobile signs, the signs that we could change our digital signboards.
Those were good. They
Yeah,
should have left
I
them up
saw
though,
the-
for the no boil, you know what I mean?
The police had that.
It's up.
The
Yeah.
police did, the one that's close to my house was taken down. So
I do
the
want
no boil
to
wasn't there.
limit this discussion a little bit, just because this is good, we should all talk about it, but we're outside of the scope of the board meeting now, so I don't think we need much more time with that, but I will say, Lindsay, thank you for everything you're doing. Thank you for talking about this and bringing this concern up. I definitely continue after the board meeting.
Absolutely.
And the only reason I say limited it's outside the scope is we have nothing to do with the regulation of that stuff. That is all a state level thing. But Lindsay is a whiz at Code Red, and I'm glad you are here to talk about it. So I apologize, but I don't want to,
No, you're good.
I don't want to eat up too much of the evening. Correspondence we had, does anybody have any correspondence to share?
I actually did have some correspondence.
Absolutely.
And seeing as everybody's here, I want to thank you for bringing up the CPR class, because Ellen is the one that brought it up at first, for having the CPR class, and Mary Jo Franny is the one that asked me where was the CPR classes, and here you are. Because we did talk about it back in February, and I just really wanted to know what was going on with that. So thank you so much
Yeah, of
for
course.
addressing that before I even asked.
Perfect. All right. Any other correspondence to share? Correspondence? No? Awesome. All right.
I will make a motion to
Oh,
adjourn the
you're
meeting.
way ahead of me. Motion adjourned by Katie. Do we have a second?
Second. Oh, sorry.
We'll let Carol have it.
Yeah, let her do it. I just usually second those adjournments.
All those in favor?
Aye.
Aye.
Aye. Opposed? It is unanimous. We are adjourned.